Hello everyone, welcome to my channel Study Nursing by Sense Schools. Today in this video we are going to discuss about fluid and electrolytic imbalance. In this video we are going to learn about how to formulate a nursing diagnosis, how to obtain subjective and objective data, what all things to monitor for a patient, how to come up with a sensible nursing intervention, and also have a look at how we formulate the nursing outcome or the outcome of your care plan. I've also given a sample scenario for you in case you want to have a model for it. So before we go into detail, let me explain to you there are two conditions where we can have the imbalance. It's either an excess of fluid volume or electrolyte in the body, or there is a deficit of fluid volume and electrolyte in the body. So in case of heart failures or kidney failure, or in case of a liver failure or a cirrhosis, you can usually see the patients on fluid balance or fluid or electrolytic excess. All right. Whereas when we talk about the deficit, if they have nausea, vomiting, or any of the active conditions, including infections or even exposure to sun, all those things can result in fluid volume deficit. So these are the two things to consider. I have prepared the care plan considering both the conditions, but it's totally up to you to take this care plan, consider this care plan, and design it in such a way that it is suited to your patients. But don't worry. I believe I have included much points so that you can play with it and prepare a sensible one. With this, let me take you all through the first step, which is assessment. So, before we formulate a nursing diagnosis, it's important to capture a couple of data from your patient. So, in the assessment, you may or may not have the subjective data. The patient may tell you that what they are experiencing, or in some cases, if the patients are tired or if the patients are not able to speak at all, might not be able to tell you what they are experiencing. So, in that case, you may or may not have the subjective data. But in the objective data, in the assessment, a couple of things that you can observe is the neck vein distension. It is especially relevant in case of cardiac failures. You can also look for sunken eyes, that is more relevant in case of dehydration, any swelling or any edema in the body, especially if you're an experienced one, or if you are a student who really enjoys cardiology, you might be knowing about how to differentiate between pitting edema and non-pitting edema, right? So in the assessment you can look for edema and the characteristic, and the next picture or the image I've put across is a tongues. So in case of dehydration, you can look for any dry mouth, or you can even look for a coated tongue. All right. And most importantly, urine, how much output the patient is having, what are the characteristic of urine, is it appearing diluted or concentrated, what is the odor, is there any fruit odor, is there any foul smell that the patient's urine have, or any other characteristic, is there any blood in the urine. So all these things you can capture in your objective data. And of course, as important as the last point I told, vital signs. So capturing a proper and detailed full set of observation is also needed for your objective data. And you also record the characteristic of skin in the assessment. You look for the appearance of skin, whether they appear pale, whether the skin, whether they have any swellings, any impaired, any trauma, any active bleeding. You also look for the feel of skin to touch, whether whether they are warm or cold, etc. So these are the things that you might want to capture in your objective data. So these are included in the assessment. So you go to the patient, obtain as much as data as you can, and you monitor a couple of things in this care plan. You monitor the daily weight, observation, intake and output, and blood tests. The rationale for or for all these things would be to monitor the progress of your nursing care, as well as monitor the progress for the medical care. So daily weight, especially when they are put on intake and output chart, or especially when they are put on a diuretic medication, it's essential that you obtain the daily weight. Vital signs is critical because that can indicate any of the risk or impending danger. Intake and output will not only help you and the doctors, but also the dietitians or any other interdisciplinary professionals taking part in the patient's care. Okay. The next point is blood test. This is especially relevant in case of any acute or active diseases. Once again, we go back to the cardiac failures or renal failures or liver failures, where some of the electrolytes, including magnesium, calcium, potassium, and phosphate, which are integral to the circulation, can be monitored through a blood test. So these are a couple of monitoring things you can consider for your patient who is either having fluid and electrolytic imbalance or deficit. So let's see a nursing intervention. I've only put three images here, but as nurses or as student nurses, you can consider two things mainly as a priority. One is to ensure that we provide the treatment to correct the existing problem. I'll give an example. If your patient has fluid balance excess, then look out for the doctor's order to begin the diuretic medication, whether it is a bolus injection, or whether it is tablet, or whether it is a continuous infusion. You need to execute the doctor's order. Imagine if it is a fluid balance deficit. In that case, you might want to look out for the orders for any glucose infusion, or any normal saline infusion, or any of the additional orders from the dietitians to encourage the liquid, or obviously the food. So the first priority is to make sure that your patient is safe circulatory wise and also physiological wise by executing the orders as per executing the orders. All right. The second thing I would say is to participate in any priority tests. Imagine your patient has ascites, and because of that he is having fluid volume excess, or even say because of that the fluid is trapped in the interstitial body and the patient experiences a deficit in particular electrolytes. In that case, you might want to assist the doctors in a peritoneal tap, or in a ascitic fluid tap. So depending on your patient's condition, I repeat, the first priority would be to ensure that the patient remains safe by executing the orders, such as the medication administration or the fluid infusion. The second is to assist, or even to take a blood sample and send it to the lab, isn't it? So to participate in the test, so as to um, uh, ensure that we have a baseline data of what we are doing, isn't it? And the next one would be obviously to position the patient. Make sure that you consider their preference into when we are providing a comfortable one in the bed, or even if they prefer to be seated, that would be all right depending on the condition. The second point is preference. I would tell you a story where I have encountered. It has not happened only once, but multiple times, especially when I was working in the cardiac ICU. So many times when they have any cardiac conditions, the doctors prescribe electrolytic preparations, either in the form of sachet or in effervescent tablets. And sometimes when the patient is alert oriented and they have the mental capacity, they would tell you that they would taken the medication, but sometimes they might not. So when it is recorded as a drug is given, but in reality the patient has not taken the drug, the doctors can imagine that this drug is not enough, and they might increase the order or the volume or concentration. And imagine you are giving those potent electrolytes as a double dose to the patient. They are not unfortunately going to get better with that, isn't it? So it is important to consider their preference, check out with them how they feel with the preparations. If they are not so happy in receiving those, escalate it to the healthcare provider so that they can help you, they can help the patient with appropriate medications or any other alternative form of treatment to the patient. So this is really important. A second thing is when the doctors or the dietitians recommend to increase the intake, including food and fluids, you might go to the patient and force them to take it, but it's not at all desired. Instead, you can check with the patients. If it's not contraindicated, you can offer ice chips, ice creams, or any other food which they prefer, compared to sometimes the hospital food which they might not like. This is what I meant with that point. And third, but another critical point is skincare. It's really applicable when you take care of elderly patients, because adequate skincare is necessary when you take care of fluid balance excess or deficit patients. Someone with a fluid balance excess can develop a swelling or an ulcer, and it can worsen if they have conditions such as diabetes. So I'll tell you in detail. So in the skincare, if your patient has diabetes or any other pre-existing condition including cellulitis, if the fluid volume is excess, that swelling or edema can worsen, and they can result into some other condition as well. So it's important that you reach out to the respective team member in your healthcare team and seek out their recommendation on how to care for them. The second aspect is where your patient is in the deficit, and they are more likely to develop pressure ulcer. In that case as well, you reach out and you have a discussion with your team and consider what all additional nursing intervention or what all additional medical intervention can be considered for such patients so that their skin remains healthy. All right, so these are the ones which you can consider. And with this, we have come to the end of part one. In part scenario, we'll discuss a nursing care plan in detail, including the nursing diagnosis as well as the outcome. All right. So this is a scenario in front of you. You have got a 63-year-old lady, and she's admitted in your ward with nausea and vomiting, followed by a travel, and she's not so keen into eating or anything, and no allergy history. Um, in the assessment data, I was lucky enough to obtain a subjective data which says Alice is tired, she doesn't feel like eating at all, and she also fears that she might throw up if she attempts to eat. In the objective data, I would capture the following ones. I will not be writing anything in particular because sometimes some of you accidentally can copy it and present it, but as we are dealing with excess as well as a deficit condition, it might not correlate, and this information might become misleading. All right, so in the objective data, you capture a head to toe assessment. Remember, I have already shared with you a couple of images where you go and assess in the patient. Let me know if you wish to have a head to toe nursing assessment presentation as well. I'll be happy enough to design that. All right, so that being said, you obtain a data from head to toe and record what are the abnormalities or abnormal findings that you were able to point out. You also take a full set of observation and record it. You additionally take the body weight, the body mass index, you calculate based on the body weight. You also check with the patient what's the usual weight versus the present weight. And if there is a huge difference or if there is a marked difference, you check with the patient for any existing conditions or any relevant incident that happened recently, etc. All right. So that's also involved in the history taking. Intake and output chart, if it's available, you can obtain and record it in your objective data. And sample collection in the objective data, you can obviously record the urine sample you have taken or the blood sample. All would be could be included. It could also be become a useful data. And as I've told earlier, you take mental or neurological data where you rule out any delirium or confusion or anything in the patient. All right, so these are the set of my objective data. In the nursing diagnosis, based on those datas and assessments that I've done, I have formulated the nursing diagnosis, which is fluid volume deficit as evidenced by in the place of signs of dehydration, I would replace them with any abnormalities that I have found. For instance, I can say fluid volume deficit as evidenced by abnormal decreased blood pressure, sunken eyes, and verbalization of feeling tired most of the time. All right, so you can always paraphrase the nursing diagnosis based on the instances or based on the scenarios. So let's see what my goal is for Alice. So for Alice, I my goal is that she establishes a normal balance. My intervention would be, as I have told you earlier, my intervention would the first intervention would be to correct the dehydration first. So when I find out that my patient has a low BP or my patient has any other abnormalities which could be corrected instantly, I would look for the record and administer any fluids the doctors have prescribed for Alice. Second is to participate in the care. For instance, imagine I've taken the bloods and sent it to the lab, and the results have come indicating infection. In that case, the doctors would be prescribing antibiotics. So I would obviously administer it as per the rights of medication. I would at the same time consider Alice's preferences, what she thinks of increasing her fluid intake, increasing her food intake, etc. And would she prefer to have the food from outside? I mean, from home, or any other preferences are there? Whether she consider an alternative fluid, including coconut water. Yeah, so these are the things that I would consider when speaking about preferences for my patient. I would also ensure that I make her comfortable by providing adequate support and positioning her accordingly, and most importantly, would not rush her or force her to take what is more than what she wants, and would space the activities accordingly. For instance, I might have, as a nurse, a lot of activities, but at the same time, I would also consider Alice's preferences more. For instance, if she's someone who wants to sleep or take rest most of the time, uh, I can respect her decision and minimize the interventions thereby providing her more rest and comfort. All right. It's also important that I would consider regular mouth care or hygiene, because that not only decreases the risk for infection but also increases the chance of recovery. All right. So these are the nursing intervention that I can consider, and as an evaluation I can write at the end of my shift, Alice had established fluid balance as evidenced by improved vital signs. You can write the value, absence of vomiting, and verbalization. So into verbalization you can put in inverted comma what your patient has told you exactly. So, with this, we have come to the end of the care plan, nursing care plan, which is fluid and electrolyte imbalance. We have discussed both the fluid volume excess and fluid volume deficit. If you like the video, consider watching each of it in several intervals, and I'm sure you can evolve as a confident nurse. Good luck with your career, and thank you so much for watching.